Hyperthyroidism refers to excessive amounts of thyroid hormone, Th, which is secreted from the thyroid gland. This would leading to a condition called thyrotoxicosis followed by increasing in basal metabolic rate and sympathetic nervous system activity. Cause of hyperthyroidism are primary and secondary. Primary hyperthyroidism result in primary alterations of thyroid hormone levels. It's commonly seen in Graves' disease, toxic multinodular goiter, solitary toxic adenoma, and follicular thyroid carcinoma. Secondary hyperthyroidism is related to disorders of pituitary gland that secreted excessive amount of TSH that's seen in individual with pituitary tumor. 3 pathological conditions that seen in hyperthyroidism includes 1. Graves' disease, affect 50 to 80% of cases of hyperthyroidism, more common in women between 20 to 40 years of age. Graves' disease results from type 2 hypersensitivity, which there is stimulation of the thyroid-stimulating antibodies directed to TSH receptor. Genetic and environmental factors play an important role in the pathogenesis. These autoantibodies, called thyroid-stimulating immunoglobulins or antibodies, TSI or TSAB, which is agonist to TSH on their receptors on thyroid gland.
Thyroid, give me TH, and I won't kill you. Okay, TSI, but please don't kill me.
As results, due to cellular adaptation, thyroid follicles may undergo hyperplasia and hypertrophy in order to increased production of thyroid hormones, which leading to enlargement of thyroid gland which known as diffuse goiter. High circulated TH level causing low TSH secretion from pituitary as usual response to negative feedback. Ophthalmopathy and pretibial myxedema is the major symptoms of Graves' disease. Ophthalmopathy, patient with Graves' disease usually develops exophthalmos that refers to protrusion of the eyeball. It's due to functional abnormalities, resulting from hyperactivity of the sympathetic division which prevent eyelids from closing completely. Substantial changes of interstitial connective tissue involving the orbital contents, causing enlargement of ocular muscle. These changes result from TSI binds with receptors on orbital fibroblasts, turn out increasing secretion of hyaluronic acid, orbital fat accumulation, inflammation, and edema leading to exophthalmos. Periorbital edema and extraocular muscle weakness lead to diplopia, double vision, irritation, pain, lacrimation, photophobia, blurred vision, decreased visual acuity, papilledema, visual field impairment, exposure keratoses, and risk with corneal ulceration. In pretibial myxedema or Graves' dermopathy, caused by very high levels of TSI, characterized by subcutaneous swelling on the anterior portions of the legs and erythematous skin. Graves' dermopathy is associated with TSH receptor on fibroblasts that stimulate excess amounts of glycosaminoglycan, hyaluronic acid and chondroitin sulfate, to build up in the dermis and subcutaneous. It also appears on the hands giving the appearance of clubbing fingers called thyroid acropathy. 2. Hyperthyroidism resulting from nodular thyroid disease. Normally, thyroid gland enlarged in response to an increased secretion of TSH, as result the increased number of follicles that occurs during puberty, pregnancy, iodine deficiency, or infection. And when the condition resolves, TSH secretion normally decreases and the thyroid gland returns to its original size. But irreversible changes may occur in some follicular cells, which it is function autonomously and produce excessive amounts of TH. Toxic multinodular goiter occurs when there are several hyperfunctioning nodules leading to hyperthyroidism. If only one nodule becomes hyperfunctioning, it is termed solitary toxic adenoma. The incidence of malignancy in toxic multinodular goiter is estimated to be as high as 9% and 10.5%. This condition is more common in iodine-deficient regions. 3. Thyrotoxic crisis, thyroid storm. Rare but very dangerous form of thyrotoxic state, death can occur within 48 hours without treatment, which usually followed by cardiac arrhythmias or hypovolemic shock. It may occur in individuals who have undiagnosed with severe hyperthyroidism and subjected to excessive stress from other causes, include infection, trauma, seizure, burns, surgery, emotional distress, etc. The symptoms of thyrotoxic crisis develops by the increased action of thyroid hormone exceeding over metabolic demands. The systemic symptoms of thyrotoxic crisis include hyperthermia, tachycardia, especially atrial tachydysrhythmias, high output heart failure, agitation or delirium, and nausea, vomiting, or diarrhea that contributing to fluid volume depletion. Classic clinical manifestations of hyperthyroidism include weight loss despite increased appetite, heat intolerance, sweating, tachycardia, with increased cardiac output, arrhythmia, atrial fibrillation, tremor, anxiety, insomnia, staring gaze with lid lag, diarrhea, oligamenorrhea, and muscle weakness. Enlargement of the thyroid gland, goiter, is common in hyperthyroid conditions caused by excessive stimulation of TSH receptors. Exophthalmos and pretibial myxedema occurs commonly in Graves' disease. Diagnosis of hyperthyroidism based on related symptoms and laboratory finding that shown, increased total and free thyroxine, T4. TSH would decrease in primary hyperthyroidism but increased in secondary. Hypocholesterolemia and increased serum glucose, due to gluconeogenesis and glycogenolysis. Thyroid scan with radioactive iodine, is used to test for increased uptake in primary hyperthyroidism. Hyperfunctioning nodules may be palpable on physical examination. Biopsy, done by fine needle aspiration if suspicious with malignancy in toxic multinodular goiter. Treatment of hyperthyroidism depending on different causes. Antithyroid drug therapy such as methimazole or propylthiouracil, used to inhibit thyroid hormone synthesis and peripheral conversion of T4 to T3. Radioactive iodine therapy, used to destroy any cancer cell of thyroid gland. In thyrotoxic crisis, usually required propylthiouracil, beta blocker, steroid and supportive care. Surgical removal partially of thyroid glands may require in some cases. However, a major complication of treatment for hyperthyroidism could result hypothyroidism. In summary, hyperthyroidism refers to excessive amounts of thyroid hormones are secreted from the thyroid gland, which leading to a condition called thyrotoxicosis shown by increasing in basal metabolic rate and sympathetic nervous system activity. There are two types of hyperthyroidism are primary and secondary. In primary hyperthyroidism, due to primary alterations of thyroid hormone levels that could be seen in Graves' disease, toxic multinodular goiter, solitary toxic adenoma, and follicular thyroid carcinoma. Secondary hyperthyroidism is related to disorders of pituitary gland that secreted excessive amount of TSH that's seen in pituitary tumor. Symptoms include weight loss despite increased appetite, heat intolerance, sweating, tachycardia, goiter, arrhythmia, atrial fibrillation, tremor, anxiety, insomnia, staring gaze with lid lag, diarrhea, oligamenorrhea, and muscle weakness. Diagnose based on related symptoms, physical examination, laboratory finding and thyroid scan. Treatment of hyperthyroidism depending on various causes. It could be controlled by antithyroid drug therapy, radioactive iodine therapy, beta blocker, steroid, and supportive care. Partial removal of thyroid glands by surgery, may require in some cases. That's it for the topic. If you find this video useful, please give us a like and don't forget to subscribe. Thank you for watching.